Hello and welcome to another episode of Health Matters. I am your coach. I am Dr. Michael Chillemi. And in this episode, we are calling it, the title is going to be Understanding Fibromyalgia, the Science, the Symptoms, and the Solution. Okay, with that, let's jump right in. So on today's episode, we're going to explore the complex and often misunderstood condition known as fibromyalgia. Whether you're someone who has been diagnosed with fibromyalgia, suspect you might have it, or simply are curious about it, this episode is here to give you the ultimate deep dive. We'll start by defining what it is, explore how it affects the body and mind, discuss all the various treatment that is available, from conservative approaches like physical therapy and regen medicine to non-conservative methods. We're going to also dismantle some of the myths surrounding fibromyalgia and shed light on how it can affect someone's everyday life. So buckle up for a highly detailed, science-based journey on fibromyalgia. Okay, so obviously the first question is, what is fibromyalgia? Fibromyalgia turns out that simple question is, what is it? It has an incredibly complex answer. So fibromyalgia is a chronic disorder characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, cognitive issues, and sometimes emotional distress. It's unique in that it doesn't involve obvious physical damage to the muscle, bones, or organs, unlike other conditions like arthritis, where you could see it on x-ray, or herniated disc, where you would see that on MRI, or different conditions where you would have blood levels and you could see what that actually is. Fibromyalgia is classified as a central pain syndrome because its origin lies in abnormal pain processes by the central nervous system. In other words, for people with fibromyalgia, the brain and spinal cord amplify pain signals, making everyday sensations like pressures or mild aches very, very painful. So, next question you might have is, well, how common is it? Fibromyalgia is more common than most people realize. Here are some facts about its prevalence. According to the CDC, Center for Disease Control and Prevention, about 4 million adults in the United States, roughly 2% of the population, are affected by fibromyalgia. Fibromyalgia is more common in women, who make up 75 to 90% of all the diagnosed cases. Although it does affect men and can even affect children. It typically develops in middle adulthood. What is middle adulthood? So typically that's 30 to 50 years old, but there are cases in younger and even older adults. Globally, it is estimated that between 2 and 4% of the population has fibromyalgia. These numbers suggest that millions worldwide are grappling with this invisible condition. Okay, so segment 2, what happens in the body, the anatomy of fibromyalgia? To truly understand how fibromyalgia works, we need to take a closer look at the anatomy of pain and the nervous system. So fibromyalgia appears to be a disorder of pain processing in the central nervous system. The nervous system, the core dysfunction. So central sensation in the fibromyalgia is the CNS, comprised of the brain and spinal cord. As you can see, I just had a moment with that. This area becomes overly sensitive to pain stimuli. The phenomenon called central sensitization, meaning that even small pain signals are amplified. Abnormal neurotransmitters also are affected. People with fibromyalgia have abnormalities in levels of key brain chemicals like serotonin, dopamine, norepinephrine, which regulate pain and mood. Additionally, an excess of substance P, a chemical that amplifies pain signals, has been found in the spinal fluid of fibromyalgia patients. How does it affect your muscles and tissues? While fibromyalgia doesn't actually damage muscle or connective tissue or joints, patients report widespread and persistent muscle stiffness, aches, and hypersensitivity. There's also evidence of reduced blood flow to muscles, which could contribute to the sensation of increased pain or fatigue after exertion. There is a link to the hypothalamic pituitary adrenal complex, the HPA. The HPA axis, which helps control your stress response, becomes dysregulated. This leads to lower cortisol, making patients feel fatigue, less resilient to stress, and prone to flare-ups. Fibromyalgia and sleep. So fibromyalgia can disrupt deep sleep stages, making it difficult for the body to recover and repair itself. The lack of restorative sleep worsens symptoms like fatigue, cognitive dysfunction, and pain. Sleep is critical. If your body does not regenerate overnight, your ability for your cells to actually make the energy and change over and re-heal themselves overnight, because that's what your body does overnight. It heals itself, it treats itself, it gets your body re-regulated. If you don't sleep, your body will not do that, and you will have some of these other symptoms that we're talking about. So what are some of the conditions that are associated with fibromyalgia? So fibromyalgia is often seen along a lot of different conditions. So irritable bowel syndrome, chronic fatigue syndrome, depression and anxiety, temporomandibular joint, TMJ, migraines and tension headaches, autoimmune disorders like lupus or rheumatoid arthritis. These overlapping conditions make fibromyalgia even harder to diagnose and manage. So segment 3, we're going to call this, what causes fibromyalgia? How do you get it? So when we're talking about the causes of fibromyalgia, and here's the frustrating part, there is no single cause. Instead, fibromyalgia is believed to result from a combination of genetic, environmental, physiological, and psychological factors that work together to disrupt the body's pain regulation system. This complex makes it particularly challenging to pinpoint a specific trigger for the condition in any given patient. Let's unpack the most commonly recognized contributing factors to fibromyalgia so we can make sense of this mysterious condition. So let's talk about genetics. Genetics studies have suggested that fibromyalgia often runs in families, highlighting a genetic predisposition to this disorder. Researchers have found that certain gene variations may increase an individual's risk for developing fibromyalgia, particularly those involved in pain regulation. Genes related to how pain is processed and perceived by the nervous system may play a role. For example, mutations in genes involved in serotonin or dopamine or norepinephrine signals may amplify a patient's pain perception. Neurotransmission function. When you have imbalances in the brain chemicals that regulate mood and sleep cycles, for example, serotonin or GABA, GABA is GABA aminobutyric acid, may make the nervous system hypersensitive to external stimuli. Some studies suggest that people with fibromyalgia may process pain differently at the genetic level, leading to sensitization long before clear symptoms emerge. Okay, so what are some of the triggers that somebody might have? Even if someone has a genetic predisposition, they might not develop fibromyalgia unless they encounter one or more of the triggering events. These triggers can act like a catalyst, pushing the nervous system into a state of chronic overactivity. Common triggers include physical trauma. So what happens is many people with fibromyalgia may experience physical trauma such as a car accident, falls, or surgeries. Before developing symptoms, these events may cause localized injury or dysfunction in the nerve signaling system, which over time snowball into chronic widespread pain. Why it matters. Research suggests that these symptoms of trauma may rewire the central nervous system, amplifying pain and making the body less able to regulate them. Emotional and physical stress. So events like prolonged stress, abuse, or post-traumatic stress disorders can also be a trigger for fibromyalgia. Emotional distress impacts the hypothalamic pituitary adrenal complex, the HPA. It's a major stress regulation system in the body. When this system is chronically overactivated, it can lead to hormonal and neurochemical imbalances and therefore increase inflammation and pain sensitivity. Okay, let's talk about viral or bacterial infections. Some people develop fibromyalgia after battling infections such as Epstein-Barr, Lyme's disease, or even a severe flu. Certain viruses or bacteria may prime the immune system, leading to low-grade inflammation and sensation override of the nervous system for months or years after the initial infection. Increasing research are investigating whether post-viral syndromes, like those associated with long-term COVID, may reveal new links between infection and fibromyalgia. It's pretty amazing. 5 years later, we're still talking about long-term COVID and the effects of it and what it's actually done to people. It's pretty amazing. Sleep problems, the vicious cycle. So let's explore the connection between sleep and fibromyalgia. Many fibromyalgia patients struggle with non-restorative sleep, meaning they may sleep for hours long, but wake up feeling unrefreshed and fatigued. How does poor sleep cause fibromyalgia symptoms? So let's look at it. Sleep is essential for the body to recover, including how the nervous system resets itself. Deep sleep stages such as REM are critical for the body to reset. So pain relieving chemicals like serotonin are usually replaced during the night when you're sleeping. Cellular repair and inflammation regulation occur when you're sleeping. The nervous system calms down, reducing centralization linked to fibromyalgia. So while deep sleep is disrupted either by insomnia, sleep apnea, or fibromyalgia itself, the body does not get a chance to regulate its stress and pain responses effectively. Over time, the nervous system becomes hypersensitive, creating a vicious cycle where pain disrupts sleep, poor sleep amplifies pain sensitivity. The loop continues over and over and over again. Okay, let's shift gears and talk about hormonal imbalances and chronic stress. Another potential piece of the puzzle is how stress hormones and our body's hormonal system influence fibromyalgia. So cortisol dysregulation, the HPA axis, a system which we know now is responsible for regulating the body's stress system, often becomes dysregulated in fibromyalgia patients. Instead of producing cortisol, the stress hormone, in rhythmic cycles, fibromyalgia patients may experience either low cortisol level, leading to fatigue and hypersensitivity to stress, irregular cortisol release, amplifying pain perception. This means the body has a harder time adapting to everyday stresses, making patients more vulnerable to flare-ups. Hormonal changes in women. So fibromyalgia disproportionately affects women, typically 75 to 90%. Researchers believe that fluctuations in estrogen and progesterone may influence how women experience pain. especially during major hormonal transitions like puberty, pregnancy, menopause. Hormonal changes during these times may leave the nervous system more vulnerable to dysregulation, serving as a potential trigger for fibromyalgia patients. Central centralization, that word will get me today. The core of the pain problem. Let's take a step back here. While genetics, triggers, and sleep and hormonal are all critical pieces to the puzzle, fibromyalgia ultimately boils down to centralization. What is centralization? By the time we're done with this podcast, I might actually say this word correctly. I don't know if I'm going to do it, but I'm going to try. Okay. Centralization refers to when the nervous system becomes hypersensitive to pain. Essentially, the brain and the spinal cord amplify pain signals even from minimal stimuli. For example, a light touch or an ache that would normally be ignored is perceived as intense pain. The brain also interprets normal sensory input, heat, pressure, or cold, as harmful, causing discomfort or even in the absence of injury. So you might just lightly touch somebody and they might jump off the ceiling. So I have patients that come in and they'll be diagnosed with fibromyalgia, and you have to be very careful because certain areas, it's not every single area, it's certain spots, they light up in pain. So you could touch the same way throughout the whole entire back, and you hit that one spot and they jump up almost off the table. That's how much pain it can be for a patient. So let's bring it all together. A multifactorial condition. All of these factors, genetics, triggers, sleep problems, hormonal dysregulation, work together to cause the development of fibromyalgia. However, because every case differs slightly, researchers believe the condition has multiple subtypes. For example, one person may develop fibromyalgia after a car accident due to long-term activation of the nervous system. Another person may develop fibromyalgia as a part of a family history of chronic pain conditions, worsened by stress and sleep deprivation. Additional risk factors. Let's quickly touch on a few specific lifestyle and health factors that may increase the risk of developing fibromyalgia. Obesity. Chronic inflammation and stress on joints can exacerbate symptoms. I think every podcast that I have done has talked about a risk factor of obesity. It should go at this point without saying that the more lean we are, the more healthy we are, the less inflammation we have and the less strain on the joints. It's just a better practice if we can be a lighter society. Okay. Mood disorders, depression and anxieties are strongly linked to fibromyalgia, both as causes and consequences. Sedentary lifestyle, lack of physical activity can reduce the production of pain-relieving chemicals and worsen stiffness. So while the exact cause of fibromyalgia remains elusive, we know that the results of multi-interreaction factors. For some, it's rooted in genetics. For others, it takes shape after trauma or during hormonal changes. Regardless of the cause, the effects are real. And as we move forward, understanding these triggers will help us understand not just how to treat patients, but how to manage fibromyalgia. Okay, segment 4, we're going to talk about how fibromyalgia affects life. Fibromyalgia takes an enormous toll on physical, emotional, and social well-being. Here's how. Cognitive problems. It's called fibrofog. I don't know if you ever heard that term, but it's fibrofog. Difficulty concentrating, forgetfulness, and trouble making multitasking decisions, and they can cause challenges at work or at school. So basically, your brain is foggy. Similar to the COVID fog that people have at this point, but it's a different cause, obviously. Emotional impact. The chronic pain and fatigue lead to frustration, anxiety, and depression. Relationships often suffer as families and friends often struggle with this invisible illness. Physical limitations. Simple tasks like walking upstairs, lifting objects, or even standing for long periods can become overwhelming. People with fibromyalgia may feel trapped between their pain and their inability to fully participate in life. Okay, let's talk about treatments for fibromyalgia. Conservative, we're going to talk about first. So fibromyalgia is notoriously challenging to treat because it affects the central nervous system, musculoskeletal systems, and emotional well-being. While there's no cure, conservative treatments like physical therapy and chiropractic care focuses on relieving pain, restoring function, and improving the quality of life. Let's break down these approaches and explain what's done and explain why they can be effective. So physical therapy and fibromyalgia. Physical therapy is one of the most valuable components of fibromyalgia treatments because it directly targets muscle pain, stiffness, and dysfunction. It provides structured exercises, stretches, and manual therapies designed to gently improve mobility and alleviate discomfort without overloading the already hypersensitive areas. What is done in physical therapy for fibromyalgia? So physical therapists tailor their approaches based on their individual symptoms, their triggers, and their physical limitations. Common strategies include gentle stretching, focusing relief on tight muscles, reducing stiffness, and improving range of motion. What's done is the physical therapist will guide patients through gentle stretching and targeting specific areas, the areas that are problematic for that patient, whether it's the shoulders, hips, knees, or back. These stresses decrease muscle tension and improve flexibility, which often reduces the fibromyalgia symptoms. Why it works. Stretching counters the muscle's tightness, often triggered by fibromyalgia's pain signals. It alleviates stress on the musculoskeletal system. Low impact exercises. That typically is done during physical therapy to improve circulation, reduce fatigue, and boost overall wellness. Therapists induce low impact activities such as walking on a treadmill, cycling, swimming, or water therapy. Exercise has been shown to reduce fibromyalgia-related pain by increasing endorphins, which are typically natural painkillers, improving sleep, and enhancing strength and stamina. However, aerobic exercises are carefully paced to avoid flare-ups. So you don't want to do too much because you don't want to hypersensitize the area, but you want to do enough to get a physical response, right? So you want to get your endorphins up so your body's producing them so you can bring your pain down, but you don't want to do too much. So it's a balance. Strength training. Building muscle strength to reduce strain on painful joints. Resistive exercises like bands or light weights or machines are introduced gradually to strengthen the muscles around the impacted joints and improve posture. Stronger muscles provide better support for the joints and connective tissue, reducing pain, preventing secondary injuries. Manual therapy is utilized to reduce localized tenderness and tension in the muscles. Therapists may use gentle massage techniques to loosen muscles, improve blood flow, and reduce pain sensitivity. They avoid aggressive manipulations as fibromyalgia patients are often hypersensitive. Massage stimulates blood flow to promote healing and reduce muscle knots, alleviating pain and stiffness. Postural training. Addressing poor posture habits that exacerbate pain. Therapists work with patients to correct how they stand, sit, move throughout the day. Proper posture reduces mechanical stress on muscles, leading to less strain and fewer pain signals. Pain management education. Therapists will teach patients how to manage symptoms and avoid triggers. Therapists educate patients on pacing their activities, using heat or cold therapy, and modifying movements to decrease flare-ups. Empowering patients with tools for self-management improves their overall sense of control and reduces the impact of fibromyalgia on their daily life. Physical therapy addresses both the root cause and the results of fibromyalgia pain. By improving blood flow, many fibromyalgia patients have poor circulation, which contribute to their stiffness and pain. Exercise and manual therapy promote better oxygen delivery to tissues and aiding in recovery, which calms muscles overactivity down. Muscles that are often tight or overworked due to fibromyalgia-related weakness. Stretching and gentle exercises relaxes these stuck, tense muscles and muscle knots. Now let's talk about chiropractic care for fibromyalgia. So chiropractic therapy mainly focuses on the spine and nervous system and skeletal alignments to improve musculoskeletal function and reduce fibromyalgia-related pain. So when we're talking about chiropractic and fibromyalgia, we're not directly treating the fibromyalgia, we're treating the spine and the tissues around it. It's basically targeting the secondary symptoms such as stiff muscles, spasms, and joint misalignments to treat and heal those areas. And as you treat in those areas, your body stretches and you increase your functioning ability. So typically in chiropractic, we all have a little bit of a different approach, right? So everybody has a unique approach. The most common techniques for fibromyalgia include spinal manipulations, obviously hands-on spinal manipulations to restore proper spinal alignment to reduce stress on joints, muscles, and nerves. So in case you don't know, chiropractors perform gentle spinal adjustments. That's where we apply a light pressure to a misaligned vertebrae, putting the vertebrae back into the alignment. That typically will help decrease pain and inflammation. When you do an adjustment, you actually get an endorphin rush, which helps take away pain and increases blood flow to the area. Soft tissue therapy, we typically do similar to physical therapy, where we're going to work on improved muscle tone and tension in those painful areas. We're going to typically do some mild fascial release or trigger point therapy and really get those knots out gently, not hard, gently. Releasing trigger points can reduce chronic muscle tension in fibromyalgia patients, improving their mobility. When we're talking about the joint mobilization, it improves flexibility in the restricted areas. And typically, we're going to also include some slow stretching and mobilization techniques to improve ranges of motion. And that could be in whatever area that it applies, whether it's the neck, shoulders, hips, and so forth. Fibromyalgia often causes stiffness around joints, which limits movement and causes pain. By improving the mobility, we help to reduce mechanical strain on the muscles and tissues around there. So many patients with fibromyalgia experience chronic muscle and joint stiffness from abnormal brain pain signaling. When we do our adjustments, we're releasing the buildup of tension in these areas and therefore restoring mobility. That's how we're typically treating fibromyalgia patients. The best combination, though, is combining physical therapy and chiropractic. By combining physical therapy and chiropractic care, the benefits for fibromyalgia is because physical therapy is focusing on strengthening skills, movement, and muscle flexibility, while chiropractic targets joint alignment and nerve pressure relief. Both treatments complement each other by addressing different sources of pain and therefore helping the patient function and feel better. Let's talk about a new area for fibromyalgia that has shown significant promise. Regenerative medicine for fibromyalgia. Regenerative medicine is an emerging field aimed to repairing, replacing, or regenerating damaged tissue and or organs to restore normal function. For fibromyalgia patients, this approach focuses on alleviating chronic pain and improving muscle skeletal health through innovative biological-based treatments. Regenerative therapies for fibromyalgia capitalize on the ability's natural body to heal. These treatments primarily aim to reduce inflammation, promote tissue repair, manage pain effectively. Given the chronic nature of fibromyalgia and the central pain sensitization involved in regenerative treatments, they're particularly exciting because they offer potential long-term relief without relying solely on medication. So what are some of the options for regenerative medicine? So the first one we'll talk about is platelet-rich plasma, PRP therapy. What is it? PRP involves concentrating platelets, cell fragments, which are crucial for healing from your own blood. So typically what happens when you're utilizing PRP, you're drawing a tube of blood. When you do that, you put it through a centrifuge. When you put it through the centrifuge, your red blood cells drop to the bottom, your platelets are on top. Your platelets have your proteins, your growth factors, your stem cells, and all your good nutrients in them. Those are typically taken and putting it into the area of complaint. So PRP promotes cellular regeneration in damaged areas or inflamed tissue, potentially reducing musculoskeletal pain and improving function. Clinical studies show that PRP can reduce pain in conditions like osteoarthritis and anti-inflammatory processes. Such suggested potential benefits for fibromyalgia patients in managing their chronic pain. Stem cell therapy. What is stem cell? Stem cell therapy leverages the body's undifferentiated cells that can develop into different cell types to repair or replace damaged tissue. Stem cells have the ability to become various types of cells needed for tissue repair. Your body, in its infinite wisdom, will determine what it needs, and when you put those cells in there, your body will program it. So think of stem cells as a blank piece of paper with no writing on it. Your body will take that piece of paper and write code on it as if you're writing a computer code. Your body will do the exact same thing for those cells. Pretty amazing when you think about it. Pretty amazing. Stem cells can help regenerate damaged muscles or connective tissue, enhancing overall musculoskeletal strength. Research is ongoing, but early studies indicate that stem cell therapy can reduce chronic pain and promote healing in degenerative conditions, suggesting promising applications for fibromyalgia. Another regenerative product would be amniotic fluid. So amniotic fluid contains concentrated growth factors, anti-inflammatory proteins, and other bioactive molecules beneficial for tissue repair. Amniotic fluid is rich in nutrients and growth factors that support cellular repair. It provides anti-inflammatory and regenerative effects that can alleviate chronic pain. While research specific to fibromyalgia is limited, evidence from orthopedic applications showing reduced pain and improved function suggests the potential for fibromyalgia symptom management. Exosomes. What is an exosome? Exosomes are small vesicles released by cells that facilitate cellular communication and healing. They contain growth factors, proteins, and genetic material. Exosomes help cells communicate, promoting coordinating healing process. They reduce inflammation and encourage tissue regeneration. By promoting healing, exosomes can potentially reduce chronic pain. Exosome therapy shows promise in regenerative medicine for various conditions, potential applications for chronic pain syndrome like fibromyalgia. Why regenerative medicine is promising for fibromyalgia. So when we talk about targeting the root of pain, fibromyalgia involves centralized pain processing abnormalities, which make localized treatments like PRP, stem, exosomes valuable. These therapies can potentially recalibrate the body's pain response by healing damaged tissue and reducing inflammation and improving musculoskeletal health. Long-term relief. Unlike conventional treatments that provide temporary symptom relief, regenerative medicine aims to facilitate long-term healing by harnessing the body's natural repair mechanism. Best part, or one of the best parts, is regenerative medicine treatments involve minimally invasive procedures, such as injections, making them appealing options for patients wary of surgery or chronic medication use. Personalized treatments. Regenerative therapies are personalized, using the patient's own biological material to ensure compatibility and a reduced risk of reactions. This often helps the patient with this complex syndrome. Let's wrap up the regen talk. Regenerative medicine offers an exciting frontier for fibromyalgia treatments, tapping into the body's innate healing capabilities to reduce pain and improve function. While research is ongoing, therapies like PRP, stem cells, and amniotic fluid and exosome therapies hold substantial promise to revolutionary fibromyalgia care. As we move forward, it's crucial for both patients and clinicians to stay informed about these cutting-edge techniques, balancing hope with evidence-based practice. For those living with fibromyalgia, the integration of regenerative medicine into treatment plans may one day provide the profound relief they deserve. Next, let's talk about non-conservative therapy options. And there's really not that many of them, to be quite honest with you. So medications. Medications is going to be one of the big therapies that they're going to use, and that could be antidepressants. A lot of times they're trying to help regulate neurotransmitters like serotonin and norepinephrine, so they're going to give you antidepressants. They're going to give you anticonvulsant type medicines like gabapentin or pregabalin, which calms overall overactive nerves. Analgesics, the short-term pain relief medicines. Cognitive behavioral therapy, CBT therapy. This is a therapy to help patients cope with pain, reduce stress, and often triggers flare-ups. Reduce flare-ups. So with that said, this is going to bring us pretty much to the end of our segment on fibromyalgia. This is our ultimate deep dive into fibromyalgia. This is a condition that demands multidisciplinary approaches. No single treatment works for everyone, but relief is possible with the right combination of therapies. Whether you're living with fibromyalgia or supporting someone who is, remember, this is a real condition that deserves real compassion and understanding. So one of the things that over time, and it is important for doctors and patients to really understand fibromyalgia and what it possibly is and how to rule out fibromyalgia from other conditions. So doing the tests that the doctors need to determine fibromyalgia versus another condition is critical, because a lot of times you can rule out condition A, B, C, or D, and then once they're all ruled out, that's typically when they're going to put the fibromyalgia condition on. Diagnosing it is very difficult. The ability to do that is very, very difficult. Usually it's a matter of determining what it's not, right? So you go through a list, maybe you have a list of 5 or 6 diagnoses that a patient might have, and you're going to utilize testing, imaging, blood work to determine, does this patient have this condition based on A, B, C, or D? When all those are checked off as no, then typically the fibromyalgia diagnosis would be the one that they will start looking towards. But it's not an easy diagnosis, and it is not something that you will see somebody one time and say, oh yeah, you have fibromyalgia. That should not be the case. If somebody's doing that, you gotta really see why they're saying that. How can they say it so fast? Have they really explored all the possible diagnoses you might have? And is there anything they're missing? Right? So typically it takes time to diagnose fibromyalgia because you will need to rule out A, B, C, D, E or more for you to really diagnose fibromyalgia. That is my opinion. So everything that you heard today is my opinion alone. Nothing I said should constitute as treatment or therapy or something you should go out and run out and do. Please do your own research. Please talk to your physician. The information that I'm giving you, just information and knowledge that I'm giving you from me. If you have fibromyalgia or you know a family member, a friend, somebody you know who has it, please pass this along to them. Might be some information here that can help them. If one little piece of information can help them have a better day, a better life, a better week, a better month, that would make me happy. And at the end of the day, you'd be a good friend, mother, sister, brother, uncle, or just a good person, right? To help somebody else. So please pass this along to somebody else. And as I always say, we only got one of these bodies, right? So it's important to take care of it because at the end of the day, your health matters. I'm Dr. Chillemi. Till next time, be well, be safe.